appreciate that. Again, this is Carl Fisher. I'm the National Sales Director. I'm with Dillon Consulting. Dillon Consulting, we're based here in Scottsdale, Arizona. And appreciate everybody joining the call today with Barry and Ryan's organization. First of all, the Association for Entrepreneurship, the first slide we see on the screen today, that organization is an association that has been around for 20 years. It serves primarily entrepreneurs. We'll call it the gig economy. It's kind of the nomenclature these days. So many people, again, whether they're a 19-year-old tech designer, a middle-aged somebody that's selling pillows or crafts and things on Etsy or eBay, to a 72-year-old Uber driver that takes somebody from Anaheim to San Diego or whatever happens. That market is emerging significantly. There's been tremendous growth in that field. I can give statistics and what have you. I think most of you probably already know that. I'm an independent contractor, just like you all are. We all have done that probably in the insurance business for many years. But this organization, again, has been around 20 years. It is domiciled. It is based in Northbrook, Illinois. That's where its domicile or situs is. However, the administrative offices for the association, AFE USA, are here in Scottsdale, Arizona. That organization has been around for a long time. It's BBB rated, A+. The organization has approximately, right now, it's probably closing on 140,000 members nationwide. They're growing like a weed. They're probably adding 4,000 or 5,000 or more per month right now. And they're having tremendous success in the marketplace. The organization, AFE USA, is of course independent. It has memberships nationwide, and they garner benefits from consulting services for entrepreneurs, gig economy type individuals, newsletters, 65 plus benefits. It's more than that now, where it's legal, financial services, a host of benefits that are offered to members that they can access after they join as a member of the association. Included in some of the things, of course, they can get access to are insured products. Companies that the AFE USA has contracted with within the last couple of years, just to drop some names: Standard Insurance out of Portland, Kansas City Life, Chubb, MetLife, of course, Delta Dental of Illinois happens to be another one that's going to be what we're focusing on today, that particular benefit. But all of those carriers have spent a lot of money, time, and effort in the last several years vetting this organization to even get a contract with AFE USA to offer those endorsed products. So, I mean, we're very pleased with that. We're very proud of that fact. And that is our go-to business model. The organization, again, the association, you join it. Number one, that's sort of like, I presume most of you probably have your Sam's Clubs, your Costco, your AARP, your NRA, USAAA, whatever associations a lot of you probably belong to or are affiliated with, or organizations like that. You join membership first. It then gives you access to a plethora of products and services. But that's how this is, in fact, marketed and always sold. We don't sell dental insurance. We don't sell life insurance. We don't sell critical illness or what have you with Chubb. We sell the membership first. After that, everything else is made available to the member. So having said that, kind of setting that precedent, that's why it all starts with AFE USA membership. That's number one. Now that I've gotten that out of the way, let's talk about some other things. You can go to the next slide, Ryan. Okay. I just talked about this. It's an entrepreneur. USA serves independent small business leaders, 50 states. I went through that. Joining for greater purchasing power. Offer today's entrepreneur the competitive edge. Done. We can go to the next slide. It's redundant. I don't want to waste time on this too much. Okay, membership requirements. There are more than this. I'll embellish a little bit verbally, but it's anybody that's 18 years old or older. There's no age limit. You can be 18, you can be 81. You can be currently participating in some form of entrepreneurship and their family, or considering doing so in the future. So it's a very significantly broad criteria or qualification. I will add or also mention some of the bylaws. They do require that the person that joins is capable of being actively at work currently, or is capable of doing so if they're not. They also purchase the coverage themselves. It's not a thing where the brother-in-law, the neighbor down the street purchases the membership to get other types of coverage. They purchase the coverage themselves. If there's a dental plan, a life plan, a critical illness, an accident medical, whatever the potential benefit may be, each member gets one membership, and they can purchase one of that same type benefit or a product. So if they have a group term life, they can purchase one group term life. They can't buy 10. It goes without saying. The membership is, again, available to anybody 18 or over, and it's available in all states. However, not all products that we're going to be talking about are available in all states today. That may change in the future, but that's an arrangement with the association and some of the insurance companies offering products where they will or won't necessarily offer coverage today. And we'll get to that at the end. So we can go to the next screen, Ryan. All right. Now I'm going to get into the specific product that we're featuring today as one of the benefits of membership of the AFE USA, and that is Delta Dental of Illinois. The reason we have Delta Dental of Illinois is, again, the association is situs and domicile in that state. If you don't know this, Delta Dental of Illinois has well over 2 million members nationwide. A good half of them are situs in Illinois, but another 1 million members are spread out all over the country. So they do business in a variety of states. Again, I just talked about access. You can read for yourself. Highlights of this plan: there are no waiting periods for preventive, basic, and major services. And I've worked a little bit with dental insurance over the last few years. And the first question everybody asks, oh, do they cover implants? Yes, they are covered under the major services in this plan. They do have to be dentally necessary. So if you want to have a big, nice, bright smile like Barry, you're going to have to pay for it yourself if it's cosmetic. If the implant is dentally necessary, absolutely they're covered. Yes, they are under major services. But P.S., there is no ortho. That's another question everybody always tends to ask. No braces, no getting your teeth fixed, no cosmetic surgery. Do that on your own. There is one rate for all states. Big deal. Very easy to work with a product like this. So if it's in Anaheim, California, Dallas, Texas, Des Moines, Iowa, this rates for an individual, for a couple, and for a family. The 3 different tiers, all the same. No area rate factors. Additionally, the maximum yearly benefits on this are $1,000. There's 3 plans. The basic, we'll go into that in a minute. 1,000 is the, we'll call it the bottom line plan. It's called bronze. I should know that name better. $1,000 at the bronze level. Then we have a gold and a platinum, and those two have a $3,000 maximum benefit per person per policy. Now, a really neat feature of this plan that really differentiates it from everything else is that this has what they call a carryover max benefit. I think they nicknamed it to-go benefit. And what that means is if you have, for example, the gold or platinum, you have a $3,000 maximum benefit per person per policy year, that let's say you use $1,500 of the benefits. You get a crown and a cavity or what have you, blah, blah, blah. And you've used half your $3,000 in that first 12 months. The unused $1,500 that you did not use gets to be carried over into the next policy plan year. So you've not only now got another $3,000 for year number 2, but you've also got a $1,500 carryover from that first year that you didn't use, so you could have a $4,500 max benefit. The maximum allowable carryover that they will allow is up to 2 times your maximum benefit. If you have a $3,000 maximum benefit, you could potentially carry over up year to year up to $6,000. So that maybe 2 or 3 years down the road, when you really need something done, it's expensive, you've got a $6,000 benefit plan. Again, I mentioned the 18 issue, age 18, no age limit. Obviously, it's guaranteed acceptance. I don't have, it goes without saying, the Delta Dental Network is ubiquitous in the U.S. I mean, 80% of all dentists in the U.S. are affiliated with the Delta Dental Network. So they have, let's just say, adequate coverage. And of course, you've got name recognition, Delta Dental of Illinois. We can go to the next screen. Thanks. Here's the top plan I just talked about. Some nuances in each one. Again, no waiting periods. We talked about that. We covered it. This one has a deductible of $150 per policy year per person, covered person. It's waived on preventive services. So if you're going for cleanings and prophylaxis, what have you, there's no deductible that applies. It only applies to basic and major. And again, in this policy, it has that $3,000 max benefit, as we talked about. The co-insurance, preventive is 100%. Day one, basic, which is, cavities and all that routine type 2 services, 70% day one. And for major root canals, crowns, implants, what have you, 70% day one. You can see the rates for yourself, $70 for single, $117 essentially for a couple. That means you can have an individual plus child. It could be a man and wife, 2 people. And then of course the family rate is for 3 or more, and that is $169.10. And oh, by the way, I do want to point out to everyone that on these plans, covered children can be covered up to age 26, whether they're in college, whether they're living at home in the basement, doesn't make any difference, up to age 26. We can go to the next one, Ryan. This is the gold plan. This is a little bit different, a little less expensive, still very competitive. It's got a deductible of $100 per person per policy year, but it does apply to all services. So it's going to apply to your preventive, your basic, and your major. But after that's satisfied, everything's covered at those co-insurance levels up to the yearly max benefit of the plan, as you can see. It's also very much like the platinum, 100% preventive year day one, 70% basic day one, 70% major day one. And you can see the rates for yourself, a little less expensive than the platinum. We can go to the next one. Ryan, there we go. Silver plan, this is the economy plan, we call it. This might be for somebody that senior oriented or what have you, a little bit more price conscious. The deductible on this is $50 per policy or per person, but it is also waived on preventive services like the platinum plan, and it only applies to your basic and major. This particular policy has a $1,000 yearly max, but be aware of or cognizant of the fact that, again, this plan, just like the other ones, if you had a $500 procedure done in year one, used 500 of the 1,000, you can carry another that $500 unused into the next year and have a $1,500 benefit in year two. And of course, it can go up to $2,000 year by year to carry over going forward, 2 times the 1,000. The preventive, the basic, and major on this one, very simple. All co-insurance on this plan is 50%. So for cleanings, for the cavities, the major services, crowns, root canals, 50% coverage. Obviously, the rates are significantly less in this case, $38 for a single, $60 approximately for a couple, and $77 and change for a family. Okay. Membership benefits of the USA. There is an elite membership that is included. It's embedded with the plan when you purchase the membership and then opt to purchase the dental. The benefits and cost, if you will, for the membership itself, AFD USA, is embedded in those rates, that $38.29 or the $77 or whatever those numbers were, for example, have everything embedded in them. We can go to the next screen here. There we go. Here are some options that are available, benefits, I should say, to members of AFE, just to give you an idea here. They've got the Avis, the rental car, they've got Eric's Jobs, they've got UPS, ADP, EJ Pro Lease, Lens Crafters, Needy Meds, Griswold Home Care, LTCR, Long-Term Care Resources. They have Costco Wholesale, Benefit Hub, etc. You keep going on here. There we go. These are the FAQs. Hopefully this came through. Oh, there we go. It's just taking some time to load. Some questions you'll ask. Is list bill available? Yes, it is. Are there advances? No, no advance. This is truly as earned commissions. It's mailbox money, as I like to call it. Are there any waiting benefits? Again, for all practical purposes, we talked about that. There are no waiting periods for all levels. Type 1, 2, and 3. Does this include a group or just an individual plan? This is a master group insurance plan issued to the AFE USA Association. So when you join AFE USA, you get access to these benefits through this group policy, just like you get access to discounted rates for clothes and stuff that we buy at Costco, or the products that we buy through United Healthcare through AARP membership. The effective dates of all of these plans are going to be the first of the following month. You write a plan on January 1st or January 31st to enroll someone. The policy will be, the plan will be effective the 1st of February. You write it between the 1st of March and the 31st of March. It's going to be effective April 1st, period. Simple, straightforward, no ifs, ands, or buts. We don't have exceptions all over the place. It's straightforward. The network, of course, we talked about that. It's the Delta Dental Network nationwide. You can, in fact, use non-network providers. The question might be, can I use a non-network? Yes, you can. However, I think most of we probably understand when you go out of network on a dental plan, and this is a maximum allowable charge plan, MAC. Again, I presume most people know a little bit about dental insurance. That means that they've got determined rates with the networks in advance when they price the product. So if you go outside to that, to the dentist that's got 2 Rolls Royces and a Corvette like Barry does, hey, they don't need to take, they don't need to work with a network. And if they're going to charge $3,000 for a crown versus the guy down the street charging $1,000, they will be paid at a MAC rate by the network, by Delta. However, the client, then the insured, is going to have to pay the difference. So there's going to be a balance bill. Just about you can guarantee that's going to happen. So if they want to go out of network, probably wouldn't be a really good plan to use. Can they? Yes, they can. Just be prepared that you're going to pay some money out of pocket more than likely. We ask about when the premiums are charged. The initial premium, I write this on January 20th. That's the day I'm going to get charged my $38.29 or $77.70 or whatever the number is for my membership and the product. And my product's going to be effective February 1st. And the next bill that's going to happen, the next $38.29 or $77.70, is going to be drafted or charged on the 20th of the month, 10 days before it's due. So if it's effective, I bought it on January 20th, it's effective February 1st. My next due is going to be March 1st. On February 20th, they're going to charge $38 or $77 from that person's credit card or ACH to pay for that 3/1 due premium. Simple, straightforward. All right, we talked about this. Our implants covered. Everybody asks that question, if they're dentally necessary. I've asked that specific question. That means that it's got to be truly medically or dentally necessary. It can't be for cosmetic purposes. Orthodontics, nope. No coverage for braces and things like this, getting your teeth straightened. Commissions are paid on the 15th. What we mean by that is everything that gets processed the 1st to the 31st of January, payments are processed on February 15th. We would pay commissions. It's EFT to your account. All commissions are EFT. As the deductible based on a calendar, its anniversary. This policy Plan year is the policy from the policy effective date. So if I buy this on March 1st, it goes to March 1st of 2022 now. That's my policy year. So my deductible is applicable on a policy year basis, and so is my maximum benefit. It's not a calendar year basis. And finally, here's the last slide. Tells you what states it's available and not available in as of today.
Okay, thanks, Carl. I'm going to see if
I didn't trip over my tongue
open
on
this
all
up.
these things. So now I'll open it for questions or whatever you want. At this point, Ryan and Barry, I'm at your disposal.
Yeah, I'm going to go ahead and unmute everybody here.
Hey, Carl, Barry.
Hey, Barry.
I was going to ask you, is this all wet signature, or can this be done by an e-app?
It is all, in fact, e-app. What
it's all
happens
e-app.
is
Okay,
everybody
great.
that gets contracted gets their own URL, which you can, in fact, write over the phone. I guess you could do it in person if you wanted to as well. But it's pretty simple because it's name, address, serial phone number. We do have to have the social on the primary person. We have to have the names of the spouse and the kids that are going to be covered. Other than that, it's pretty straightforward. There's no health questions or anything like this. And then it's how you're going to pay for it. Which credit card? We don't take Amex for what it's worth. It's a big deal to somebody, but if it is, too bad, I'm afraid. But it's MasterCard, Visa. You can do, of course, ACH. And as I mentioned earlier, it's list bills available too.
Hey, Carl, this
Yes.
is Lee Jordan. I'm out of Nevada, so I see that you don't have it in Nevada. Is there a chance to get it in Nevada?
I'm not going to make too many promises. I have to be honest. I don't know. I would, and it's not going to happen in the next week or two, that's for sure.
Right.
Longer term, perhaps. It might be a matter of months. I don't know. It could be never in some cases. You got your silly states like Washington, Oregon, Montana, New York, unfortunately, Mass, places like that kind of,
Right.
I'm sorry, but it is what it is. And we don't want to, mess with the states. We're here to sell as much as we can, where we can. Unfortunately, some of those states are just tougher to work with. Maybe in time, but that's the best I can do.
Yeah, I was just curious. I have other states as well. I was just curious.
Okay, good.
Hey, Carl, if I'm in, let's say, Nevada and I have a client in California, do I need to have a non-resident license in California to write this dental product or no?
Great question. Excellent question. And I'll get it solved for everybody at one time. If you get contracted with Dylan to sell the memberships, number one, which you do, that's where we always start this. Anybody ever selling, quote, dental insurance won't be selling it at all because the first thing you do is you sell the membership. Then you sell the dental or CI or whatever it is we're talking about. But this is how we work this. Anybody that is selling the writing agent, selling the product to a consumer, a member that has joined, must be actively licensed in the state in which they sell that product. So if you're living in Las Vegas and you sell it to somebody in Stockton, California, no problem. Just you have to demonstrate or prove to us that you've got an active California life and health license, and that serves the purpose of you selling in that state, no problem. And that applies to everybody on this call. Now, the next question you're going to ask is, and maybe it's not such a big deal, but sometimes it is, and that is, if you're the overriding entity, you don't need a license as an override. So if I live in Arizona, for example, and I'm overriding somebody in Iowa, I don't have to have a active Iowa license in order to receive override commissions because I'm not writing the business. Anybody enrolling anybody has to be licensed in that state where it's available. That's it.
Hey, Carl, how does your renewal commission stack up against everybody else?
I'd say very good. It's really, it's a level like commission. It's a level like commission. I'm not going to talk about numbers,
Right.
but it's level like is what I call it.
If somebody's on the call with a big book of dental business, you might want to take a look at contracting because this might be an opportunity. Since there is no waiting periods, this might be a nice rollover opportunity. if you're currently sitting on lower renewal commission currently with your book of business,
Yeah.
this might be a nice transfer to a new company.
Good point. Good point. We have some. I mean, I will say is we've had kind of a nice fast start. That's good. And other parts of the country, and we got some people talking to actually some groups that have thousands of members, and they're looking at it, and everything in between. You know, whether it's 10 or whether it's 100. But you can again sell this down to one person. You're not confined to the group market, but you have a lot of availability here to market in a lot of different scenarios.
Great. Are there any other questions? We're coming up on the time here. We have about 8 minutes left. If there are any other questions, please shoot them out here, or give us a call back in the marketing department here at On Point Agents Insurance. We'll be happy to get the contract sent out to you.
Yeah, Ryan, can you hear me?
Yes, I can.
Yeah, how much is the membership for this association, or is there one?
This is Carl. I'll answer that. Again, before we talked about this, I'm not sure who I'm addressing, but is it Mike Studebaker?
Oh,
Is that
Mike
right,
Studebaker?
Okay. The rates that we showed on the PowerPoint earlier are rates that have everything embedded. So you've got the dental insurance type coverage, you've got the association AFE USA membership dues as well, all embedded into one. So they're included in that one rate.
Okay, thank you.
Thanks, Mike.
Hey,
All right,
Carl,
great.
Jim Doyle here.
Hey, Jim.
Yes, sir.
Quick question. We understand that you have to present the association, obviously. I'm going to give you an example. If an agent or myself, if we pitch it this way, as a member of the Association for Entrepreneurship, you are eligible to access a menu of benefits and products, including guaranteed issue dental.
Mhm.
Does that meet the criteria for selling the association first?
That is how you market this.
Okay.
All the time, Jim.
No, I mean, as opposed to saying, once you join the association, you can have these benefits and products. We kind of put a little twist on it by
They're
saying,
available to you. I guess
Yes,
it's just there's probably several ways of saying the same thing.
mm-hmm,
You can't get into Costco unless you show your lousy little card. You
Correct.
you can't get a med sup from United Healthcare unless you join AARP. That's just the way it works. I can't go to the Scottsdale Gun Club unless I get my little card there to go in. That's the way it works with these organizations. That's the way it works with this one. And so if you follow that 1, 2, 3, join the association, demonstrate membership, that gives you access. If you wish to purchase other products, great, God bless. If you don't have to buy dental, you don't have to buy CI, you have to purchase group term life. They're just made available to you by the association if you wish to do so. It's exactly the case. And if they say, yeah, I really am interested in that, great, let me tell you about it. You go through a dissertation like I just did with this PowerPoint that says, boom, 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 here's what it does, here's what it doesn't do, here's what it costs. Are you interested? Great.
yeah. And the reason I ask that is because the agents, I assume, are contracted to AFE, not contracted direct to Delta.
Actually,
Illinois.
that's a good point too. I'll clarify that. Maybe that'll help everybody. AFE USA is an independent organization, just like Costco is or what have you, okay? Dillon Consulting, that's why I mentioned early on, I'm the National Sales Director for Dillon Consulting. Dillon Consulting has the exclusive marketing agreement with the AFE USA to market any of their products and memberships and products. They had the exclusive. You can't work with XYZ or JKL or ABC company or agency or what have you. Only Dillon Consulting can give you access to this association membership and the subsequent products that you can offer to those members. That's the only way you can market it. And so in answer to your question, everyone is contracted with Dillon Consulting, the exclusive marketer with AFE USA. And by the way, that agreement lasts for a period of, I think it's more than a dozen years. I think it terminates in 2035 or something like this. I'll probably be long gone, but anyway, they have a multiple year agreement that's exclusive to this organization. They've had that actually for some time.
Great, thank you.
You're welcome.
There's no other questions. We'll go ahead and end this presentation, and
Great.
please reach out to your marketing office, or you can call us direct at 951-541-2684 and ask for Barry or Ryan.
Great. Thank you so much, Barry. Thank you, Ryan. Thank you, everyone else,
Thanks, guys.
for joining the call today. Appreciate your time and attention.
Thanks. Bye-bye.
Thank you.